In this video, we will review a series of high-yield questions and answers based on previously published content from the channel. These questions focus on key ophthalmology concepts that commonly generate doubt, especially for students. The goal is to reinforce understanding through clear, concise explanations of essential topics. 1. What is the normal size of the pupil, and when is it considered abnormal or pathological? In adults, normal pupil size is about 2 to 4 mm in bright light and 4 to 8 mm in the dark. Small differences in pupil size can be normal. Physiologic anisocoria is usually less than 1 mm. Anisocoria greater than 1 mm, especially with ptosis, abnormal eye movements, or poor light reactivity, is more concerning for pathology. 2. If a pupil does not dilate in the dark, does that indicate a sympathetic pathway problem? If a pupil does not constrict in response to light, does that indicate a parasympathetic problem? Yes. If a pupil does not dilate in darkness, think of a sympathetic defect, classically Horner syndrome. In Horner syndrome, the abnormal pupil is the smaller one, and anisocoria becomes more obvious in the dark. If a pupil does not constrict to light, think of a parasympathetic problem, such as CN3 palsy, pharmacologic mydriasis, or atonic pupil. 3. What are the normal CD4 count values in a patient with HIV? What ranges are considered normal, low, or severely decreased? A practical framework is: normal or relatively preserved CD4 count is about 500 cells per cubic millimeter or higher. Moderately decreased is roughly 200 to 499 cells per cubic millimeter, and severely decreased is below 200 cells per cubic millimeter. A CD4 count under 200 cells per cubic millimeter meets criteria for AIDS. 4. What is immune privilege? Immune privilege refers to a special state in which certain body sites limit inflammatory immune responses to preserve tissue function. In the eye, this helps protect vision by reducing destructive inflammation. 5. In which parts of the body, besides the eyes, does immune privilege occur? Classic immune privileged sites include the eye, brain, and testes. 6. What is the treatment for cytomegalovirus infection during pregnancy? Routine antiviral treatment is not recommended in pregnancy. Management focuses on diagnosis, counseling, and referral to maternal fetal medicine. Prenatal diagnosis may involve amniocentesis in selected cases. 7. What is vertical transmission during pregnancy? Vertical transmission refers to the transmission of infections from mother to child during pregnancy, delivery, or breastfeeding. 8. In which situations can prednisone cause damage to the eyes or vision? Prednisone can cause increased intraocular pressure, steroid-induced glaucoma, and posterior subcapsular cataracts, especially with long-term use. 9. What conditions are associated with loss of the red reflex in the eye? Loss of the red reflex can occur in cataracts, vitreous hemorrhage, retinal detachment, and retinoblastoma. 11. In which cases can a white pupillary reflex, leukocoria, be observed, and what conditions are associated with it? Leukocoria is associated with retinoblastoma, congenital cataract, retinopathy of prematurity, retinal detachment, and other serious conditions. 12. Under normal physiological conditions, when does the sympathetic system predominate in the eyes, and when does the parasympathetic system predominate? The sympathetic system predominates in darkness and stress, causing dilation. The parasympathetic system predominates in bright light and accommodation, causing constriction. 13. Does oxygen supplementation in premature newborns cause eye damage only when using masks, or can it also occur with other delivery methods such as nasal cannula or mechanical ventilation? Eye damage, specifically retinopathy of prematurity, is related to excessive oxygen exposure, regardless of the delivery method. It can occur with masks, nasal cannula, or mechanical ventilation.